There are certain myths, there are certain misconceptions about HIV and AIDS. Let's have a quick rapid fire question round, and I'm sure a lot of myths and misconceptions will be cleared. Dr. Rajan, to begin with you, can somebody have HIV without any visible symptoms?
Yes, HIV is largely asymptomatic to start with. So a person just infected with HIV may not even realize it till he gets symptoms.
All right. Dr. Neeraj, can HIV spread through touch?
No, that is something which we have to, unless there is a visual skin blood and you have lesion and you have contact with that. Otherwise, intact skin, no chance of transmission.
And can HIV be transmitted through organ or tissue donation?
If the screening has not happened stringently and the person who is donating these organs, tissues or blood is HIV positive and it doesn't turn up on the tests that are done, then such instances can be seen. But because, as I already mentioned, there are stringent standards for screening of blood, for screening of organs and tissues prior to donation or prior to acceptance, these instances are not very common.
To what extent can HIV shorten the lifespan of a person, Dr. Neeraj?
So if untreated, of course, it will shorten your life. But if you are taking adequate treatment, following the regimen which has been prescribed to you, it's like any chronic disease. It can be managed, not cured. Like say diabetes, hypertension. If you are taking medicine, you are perfectly fine. If you are not taking medicine, you will develop complications. Similarly, HIV per se, well controlled, you will lead almost a normal life.
Okay. And can people with HIV bear children?
Absolutely. And with proper treatment, we can reduce the chances of transmission from the mother to the baby. And largely, we have a larger majority of babies born to HIV positive parents being HIV negative.
All right.
So saving our next generation.
All right, Dr. Neeraj, lastly, does HIV always leads to AIDS?
So again, if it is diagnosed early and you start treatment, because we have test and treat policy now. So the earlier you start treatment, the lesser chance of it progressing to a fully blown AIDS.